Today's program focuses on customer relationship management, hospitality, service, and systems, and features the expertise of Dr. Mark Murphy and Dr. Mark Hyman. In this program, Dr. Murphy and Dr. Mark Hyman will cover the following objectives. Evaluate and choose from a variety of hospitality initiatives in dental care delivery models. Understand the role, value, and financial impact of customer relationship management. Apply metrics and measurement to hospitality and customer service systems to evaluate their efficacy and return on investment. And consider survey measurements that gauge employee and customer client loyalty and engagement.
Hello and welcome back to National Dental Network. I'm Mark Murphy, and on this episode, this segment of Excellence in Team Development, we're going to discuss various aspects of customer relationship management, CRM if you will. Maybe we'll take that in a twist as we're talking about it to think of it as hospitality issues in your dental practice. My guest today is Dr. Mark Hyman. Mark operates a full-time practice in Greensboro, North Carolina, and he's also an adjunct associate professor at the University of North Carolina School of Dentistry, a fabulous facility up there right in Chapel Hill. He's also a visiting member of the faculty down at the Pankey Institute where I teach, and I'll tell you, it's really neat having him with me today. I'm so glad he could join us because Mark brings, and first off, I love his first name, and second off, he brings such an enthusiasm and such a polish to what we're talking about today, and he can do it in spades. One of my favorite programs that I've heard Mark present snippets of, take this job, and instead of shove it, take this job and love it. Please welcome with me Dr. Mark Hyman. Mark.
Thank you, Mark. Good to see you again.
Good to have you here. I'm looking forward to talking about customer relationship management, hospitality issues. I mean, if there's anybody who could come and sit down and talk with me about that today and school me a little bit on it, even though I thought I'm pretty highbrow there, I think it's going to be spending some time with you. And one of the things that we talked about early on was this whole thing about having some sort of a first impression. And you mentioned to me that those first impressions are changing, that they're not always coming from the same place historically that we used to see them. Say more about that.
Right, Mark, what we always said, you never get a second chance to make a first impression.
Absolutely.
And traditionally in dentistry, we always thought it was going to be our fabulous reputation, our training where we went to dental school, that we trained at Pankey, the equipment that we had, particularly for us old guys who were baby boomers. The way our generation always bought and shopped and got information was the best way was a word-of-mouth referral.
Absolutely.
What we are finding for the younger generation, what has stunned me of late, is the number of referrals that I get from the internet. Because the younger generation, that is how they get their information. When you look at the statistics of the internet, years ago, I saw an article from 5 years ago, at that time 100 million Americans went on the internet for health care advice.
Holy cow.
And that's staggering. And last seminar I said, show of hands for the non-baby boomers in the house. How many of you in the last 7 days have gone on the internet to buy or to find health care advice?
Wow.
Virtually every hand went up, and it really rocked my boat and made me say, I've got to continue to rethink this. When I've talked about web pages or websites for some folks, some agree with me and some say, man, that's marketing. I don't market my practice. And I want to say, well, I understand that. You know, but that's an advertising patient. That's not what you want. Except what you find is these are men and women that have a job, are computer literate, that are busy, that are intelligent, and have found a way to find you on the internet or not.
So you mean they're going into Google or one of the search engines and they're typing in Greensboro, North Carolina?
And I found they have Googled Greensboro Dentist Cerac or Greensboro Dentist Diagnodent.
Really?
And it's stunning to me because it sort of says it doesn't matter with your training. If you bought the right piece of equipment, then you're in the ball game. And part of me wants to say, I don't want to have to play that type of game, but that is the reality of where we are today. So we can either join in or fall behind.
Do you perceive or see any difference in the types of patients that are coming to you through the internet, through this kind of first impression, if you will, than those, the old tried and traditional way that, hey, I've told a friend about you?
Right. My bias is I would want to see a difference, and I don't.
No kidding.
And that's been stunning to me.
That's rocking my world.
And it is. Another piece of that is when folks do find us the old-fashioned way from a word-of-mouth referral. What our team will say is, have you seen our website? And many times they'll say, not yet, and they'll say, well, go on www.tarheeldentist.com and check us out, instead of saying, do you know where our office is? We'll say, well, download a copy of a map to our office.
Wow.
You want to know what type of team we have? There's a picture of the team, of the women that I work for. Here's what the office looks like. Here's the type of technology we have. And a very clear statement of how we choose to serve our patients, a statement of our philosophy of how we care for our patients. So it's when you think about having patients preheated before they come into your office. We wish it was the old way, perhaps, but what better way for them to have seen an exquisite website, have a strong referral first, go see your website, and then come in to see your office, and you deliver on the promise that the internet made.
So I'd have to replace my face in my head and get something much better looking, wouldn't I?
Well, airbrush would help. I'm with you.
I got to at least touch up the hair a little bit more. Just for Men isn't cutting it anymore. So I know you wouldn't tell me this. So this means it doesn't matter how we answer the phone anymore, or we have any of those conversations? That's still got to be important.
Well, I think it is imperative. And again, what I have found is people that have shopped the internet, that have looked at several websites and are not sure who they're going to go to. We have 3 women that work up front for us. And to a person, they're fabulous on the phone. And what I have heard repeatedly, because I'll ask the patients during
now they're going to get a chance to see this video. So what are their names, Mark?
The women that we have up front is Mary Catherine, Patty, and Betty.
Okay. Hello to them.
And they're exceptional and great phone voices and kind and compassionate and intelligent and wonderful. I'm very proud of them. What I have heard from people that were shoppers of the internet and have gone to look at different websites, when they've called other offices before ours, they've gotten a lukewarm reception. When they've called my teammates, they've been blown out of the water, how inviting and welcoming and eager for someone to join our family. And so, on the one hand, it's a brand new ball game. On the other hand, it's the same game or even more important because the stakes have been raised. But if your team isn't exceptionally well trained and on board with your philosophy of care, then you can lose the opportunity to treat those patients.
And I'm hearing perhaps a third message when you're saying that it's a new game, and yet some of the characteristics of the old game are still very important. I'm hearing that those two need to be consistent, don't they?
They do.
Because if there's disharmony there, and that's what you're describing in those people who have called, they've seen something on the internet, called an office, and not been met with that warmness that you've got from your staff, there's an inconsistency of the message.
Right.
Beautiful website, you can buy that.
Exactly.
You can't fake it on the phone, and you're certainly not going to be able to fake it in person.
It's the truest thing I've ever seen. There's an expression, if you think about that, if you keep doing what you've always done, you'll keep getting what you've always got.
Absolutely.
But you know what? I just recently heard someone speak to that and say, you know, that's not true anymore. Keep doing what you've always done. You won't keep getting what you've always got because the world is moving so fast forward, you're going to fall behind if you think the same effort, the same verbal skills, the same technology, the same continuing education is going to be enough to put you in that top 5%. Things are moving so fast forward in this ADD world. I don't think it's good enough anymore. So, again, I think the message is not just pay a lot of money for a good website. Again, that's the entree, but then you've got to deliver the goods.
Okay. And you track hits, that the number of people they're hitting per month, things like that, how many pages, number of minutes per page. I know that all the kind of statistics are available.
We do.
You look at that kind of stuff.
And
cool.
it's been invigorating and scary and disappointing and kind of the whole ball of wax. And the result has been a tremendous number of our new patients. We've been in a new facility for a year and a half, and it's gorgeous. And the packaging of our product.
This is a way to show it off a little bit.
It is.
Yeah. Well, I'm glad you started there because I would not have. I would have started with, as we do so often down at the Pankey Institute, when Chris is talking to us about creating that new patient experience, Chris Sager, and we're talking about that. We're talking about that pre-clinical interview, that first patient contact, and we usually start with that's the phone call.
Right. Well,
and you're telling me
it used to be.
Move your paradigm, Mark T. It's no longer necessarily the first phone call.
That's correct.
The first contact might be they were on your website and you don't know it.
And as I said, your and my resistance is going to be saying we wish it wasn't that way.
Wow.
Or you can join up, step up, and pay the price and get an exquisite website that's not just a cookie cutter.
Okay.
We spent a ton of time. We worked with Einstein for our website, and we spent months working with a marketing person, really trying to make sure that it was distinctive and really spoke to the type of care.
I have seen it. It is very nice.
Thank
very
you.
Nice. You even link it to your some of your lectures, and you can watch some of your video clips and stuff like that.
Can.
So that's kind of neat. Cool. Now you can have a link to National Dental Network and the Excellence in Team Development Series.
Would love the privilege.
You got that. So, but they are going to get on the phone, and you are going to have that warm conversation. And what kind of things happen in that first conversation? What kind of thing happens when they first come to the office? What are the kind of customer relationship and hospitality issues that we can engage them with in a special way?
Right. When somebody calls our business team members, we have a new patient answering form.
Okay.
And they'll go through a series of questions. That kind of standardizes
so
our
systems
first.
in place.
It is a system, which I think is critical.
that.
One thing that I hate is a patient calls up, I broke a tooth. Great, they come in, the receptionist says, why are you here? I broke a tooth. The assistant takes them back, why are you here? I broke a tooth. Dr. Wonderful walks in and says, why are you here? And about that time, they're saying, isn't anybody listening to me? And it's a frustration. And what the beauty would be is, I understand you're here, Dr. Murphy, because you broke that lower right tooth. I'm so sorry. We're going to take care of that today.
You've put that right out of my mind now. I don't have to worry about it anymore.
It's just amazing. I'm staggered what poor listeners we are in the healthcare field. generally, and specifically in dentistry, I think we're so task procedure, ADA code oriented by nature, and I think that's too bad. So someone would find out about us, however, they find out about the office, they will call us, speak to one of our office administrators, they'll go through our new patient questionnaire with them on the phone. We send them a lovely brochure from the office, a welcome letter custom done on our nice stationery that I handwrite a note.
Handwrite a note, I love that too. Excellent. Touché.
And we have a newsletter that we are doing that was beautifully done as well, and we'll send a copy of that or a copy of the newsletter that the Pankey Institute has educating patients about
the oral health report.
The oral health report, which is a wonderful resource.
Thanks.
The patients will come in. We have a new patient experience that lasts an hour and we haven't cleaned teeth. And I know that's heresy to some factions of dentistry. And again, the first thing that people do instead of being handed the clipboard is hopefully they filled out their new patient material beforehand.
Sure.
They'll sit down in our office, which we have a gorgeous reception area, and with nice music, fireplace for this time of year. In North Carolina, it gets a little chilly early on. That's really nice.
We have a fireplace in the summer in Michigan. You know, it gets cold all the time.
And then they come sit in our consultation room, which we'll see a picture of in a little bit. And again, when I do my new patient experience with patients, we sit down and we talk, and I try to ask these really tough questions, like, why'd you leave your last dentist? What do you expect out of me? Is it important to you that you keep your teeth the rest of your life?
So it's not just about their past medical and dental history.
Right.
The preclinical interview goes beyond that, goes a little deeper.
And I want to know who they are and where they're from and what they expect out of me. At the end of that process, I'll say to every person, have you ever had a dentist start a visit like this? And to a person, they'll say, no, I've never had a doctor listen to me. I've never had a doctor sit down and take the time to listen to me. For people that have read 7 Habits of Highly Effective People, Stephen Covey, habit number 5, seek first to understand, then to be understood.
Absolutely.
I read that in 1989. It blew my mind because, again, most of us, I think, are very poor listeners. And again, as we were saying, I practiced for 20 years in a 1950s building, which was fine, but the packaging of the product was
not consistent with
optimal.
Who you were.
It wasn't consistent with the message, with the level of care we were giving patients and the quality of dentistry we were offering them. We have a new facility now, which was gorgeous. So patients drive up to the office and see a beautiful facility. They come in and see a beautifully decorated, with the nice music and the plants and flowers and the current magazines, the whole experience for that. What I've tried to do is have the magazines match the message of the office as well. I kind of jokingly say in the seminar, we don't have People magazine. We want higher class trash like Vanity Fair and Elle.
It's not that you don't want trash. You just want
trash
better
is
trash.
Good, but we want higher class trash. And we have Harvard Business Review.
Do you really?
We do.
It's one of my favorite journals.
And I think, again, it's making a statement of who we are and what we're trying to stand for.
Wow.
And it's interesting that I've had some people say to me, well, I'm not one of these snob practices. And I wanted to say to them, well, how do you know what your patients want unless you ask? Because someone's a single mom, does that mean they don't want to keep their teeth the rest of their life because they're from a disadvantaged background, because they've been away from dentistry for 10 years? I had a woman in yesterday that I saw in the practice who'd been away from dentistry for 15 years. And the classic drill in dentistry is what? We would browbeat her and fuss at her and where you been? Why haven't you come in? Why don't you floss?
I tried to smile while I was doing it, though.
Yes. But, you know, we're critical parents. Our dental education, we were taught to wag a finger at our patients and say, you need this done. And need is a punitive word. We prefer a better 4-letter word, which is want. What do you want for your health? Do you want to keep your teeth the rest of your life? When do you want to be finished by? We'll ask that, and that's an amazing question for patients as well. Do you have a time frame in mind? When would you like your teeth whiter? So,
I heard you say something interesting just a few sentences back. You said that you asked the patient at the end of that visit, have you ever started off a visit with the new dentist this way? And that, to me, that's an excellent opportunity you're taking there to say, let me bring this to a conscious level for you. Because you may be having an experience here with us that's vastly different than you've had in another dental practice. Just to make sure that you recognize that moment and the differences from your old paradigm that you might have in dentistry and this new paradigm that you're moving towards, that we're helping to create an opportunity for. Let me bring that to a conscious level. And so you say to them, have you ever had an opportunity like this?